The topic of adult children of alcoholics isn't one-dimensional talk show fodder for Dr. Phil or shrinks off as excuse-making material to justify juvenile behavior in grown men and women. ACOA is an exhaustingly observed and documented identification of how growing up in an alcoholic home impacts children later in life. Alcoholism is a whole family disease that isn't caused or cured by anyone in the house. Getting the alcoholic sober, it's a good start, regardless of how much we are physically present, and sometimes that was no blessing or benefit for the kids. We were vacant parents. In the vacancy of sound parental, emotional, and psychological problem-solving role models, our kids fill that vacancy with their own solutions. Some of them are quite good, some inventive, and they stick with these as they grow older. Just like it's a failed practice for an alcoholic to fix his alcoholic mind with his own alcoholic mind, ACOA demonstrates it's hazardous to have an adolescent resolve life's issues with an adolescent mind. Some characteristics of adult children: they fear their emotions and bury their feelings. That's how they dealt with it as a kid. An inability to relax and have fun. The tension in the house, undetectable to the alcoholic, creates unbelievable tension on the young. Difficulties with intimacy and tendencies to confuse love with pity, because ACOAs often get into relationships with people they can rescue the way they couldn't rescue us. All in, there are 13 common traits documented in the 1983 book, Adult Children of Alcoholics. Great reading on the topic. Sadly, many abuse alcohol too, the way they saw us do. Even if they never touch a drop or saw us flammable, our drinking sets up kids for challenges as adults if the whole family doesn't address the family disease. The ACOA research also serves as a very revealing mirror to our own character defects. It's never too late to quit, but there's more to family sobriety than just stopping drinking. I'm Scott Stevens. That's the Sobriety 60.